This is what we call an intramuscular hematoma, and what you can see is a superficial intramuscular hematoma. Means that the hematoma is confined to the muscle, but it's close to the surface of the skin or belly of the muscle, whereas an intra is deep inside the muscle tissue. Sorry, an intra is still the same in the fact it's confined, but it's deeper inside the muscle tissue. Often a lot more painful, actually. So if we look at it, then a hematoma is often a lot harder to observe, as the bleeding is limited to that confined area. And there's an increased pressure on the sensory nerve endings, which can result in this hematoma being a lot more painful than the interhematoma, which we'll talk about later. So when you're thinking about managing this type of injury, you have to consider trying to confine the bleeding, so that actually no more bleeding is affected within that area, and your efforts are directed in removing the fluid from that confined area, so they don't become too viscous. But you have to make sure that the person has sufficient rest and doesn't undertake any activity, because actually what we're trying to do is make sure that the blood vessels are sealed and repair, and that we don't break them down any further. So the sorts of treatment we would probably use are like manual therapy techniques, which is aimed at dispersing the fluids from the damaged tissue areas. So you'll often use kind of sort of massage techniques to try and reduce, or massage compression techniques to try and remove the fluid from that injured area. And depending on the feedback you get from your client, it could be that actually you have to reduce the rates at which you're working with them at, or you can increase them. In initial phases, we're not looking for compression bandages, but after sort of 3 weeks, we then can start to consider the compression bandages. Okay, this type of injury often takes around, so if we're talking about a dead leg, it can take up to 6 weeks, if not longer in some cases. But it is important that you manage the athlete and make sure that they don't go back into physical activity while there's an intrahematoma there. If at all you are concerned that there's some clotting, then it's straight away a 999 into the hospital, because actually blood clots can have a greater impact.